Hi, my name is Jessica Grunt. I'm one of the CA3s here at UT Southwestern Department of Anesthesia residency program. As we progress through our CA2 and 3 year, we build on the general anesthesia principles set forth in our CA1 year, and we move into our anesthesia subspecialties, including pediatric anesthesia, cardiothoracic anesthesia, neuroanesthesia, acute and chronic pain. As CA1s at our program, we actually have the opportunity to rotate through OB anesthesia quite early on in the operating rooms with the C-sections. But as a CA2 and CA3, you have the opportunity to serve as epidural manager with the laboring epidurals, which is a really wonderful experience because we do have one of the busiest labor and delivery departments in the nation. We also have the opportunity to serve as the PACU resident or post-anesthesia care unit, as well as opportunities for chiefing months. What we mean by chiefing months at this program are opportunities to serve as the anesthesia board runner overnight and serve as a kind of pre-attending role where you kind of supervise and mentor your CA1 overnight. Regarding our call schedule, as CA1s, we have a little bit more front-loaded in-hospital call. As you move through CA2 year, you'll notice that you may have a little bit more call overall in the year, but it's pretty much all home call, which most residents tend to prefer. And then additionally in CA3 year, depending on your schedule, you'll have probably the least amount of call, again, most of which will be additional home call.
I'm Joseph Sophia. I'm a CA3 here at UT Southwestern, the anesthesia residency. One of the benefits of being at a large hospital center like UT Southwestern is getting to rotate through a freestanding children's hospital, a children's medical center here in Dallas. It's a 487-bed hospital with a level 1 trauma center and a level 4 NICU, and the faculty there are very supportive and super enthusiastic. There's a wide variety of cases that we do, complex cases, and just a variety of ages from neonates and even bedside procedures in the NICU to complex procedures in the operating rooms themselves. We have a lot of off-sites that we work at as well in the MRI suite and the procedure room. There's really no shortage of cases there. I think one of the unique features of our residency program is that it's a large program. We have 20 residents per class, but yet we get to kind of cater our experience to what we're looking for individually. And one of the ways that my experience was catered to here was because I had an early interest in pediatric anesthesia. I was worked into the pediatric operating rooms early on in my residency and actually got to do 2 months as a CA1, and that's typically reserved for CA2s and above. And it was really good for me to get that early experience and establish myself both at the hospital and also my career plans for applying to pediatric anesthesia.
I'm Noah Jewett. I'm a CA2 here at UT Southwestern Anesthesia. So I guess in particular to the cardiac rotations here, as a CA2, we do at least 2 months of cardiac anesthesia, not including the year CA3, in which we do more. UT Southwestern in general is a referral center for cardiac surgery. So we routinely take care of people from all over Texas, from all over the United States, even some patients from abroad as well. So really it's an amazing and incredible opportunity to be able to participate in those kind of cases and to learn from the faculty here. And ultimately, regardless of whether, I will pursue or if you as a potential resident would pursue cardiac anesthesia, ultimately it makes you a more rounded anesthesiologist in general. Also, cardiac anesthesia is really nice because you get a lot of procedure volume. We're not lacking in procedure volume at all on the cardiac anesthesia rotation. Typically, every patient will get an awake A-line, will do a central line, sometimes even awake, as well as, of course, an intubation, just like you would for any other case, and many other procedures that, we could be doing, as well as TEE. In fact, in addition to some of the, basic skill acquisition of TEE that we get as CA2s, CA3 actually has a dedicated month or two where you actually go from room to room in every cardiac case and practice acquiring TEE images and going over the TEE images with faculty, identifying various pathologies and etc. To further hone TEE skills as an anesthesiologist. Case complexity for cardiac surgery here really runs the gamut from your basic simple CABG, 2-vessel CABG, 3-vessel CABG, whatever, to more advanced, minimally invasive valve replacements, to patients on essentially full ECMO support, requiring heart, lung transplantation, etc. So really, you see it all here.
Hi, my name is Syed Jaffrey. I'm a CA3 here at UT Southwestern Anesthesiology. I chose UT Southwestern for multiple reasons. One largely being that I wanted to go to an institution that provided multiple opportunities and as well as allowed you to get your numbers quite easily. Here at UT Southwestern, we have large volume of cases, high acuity cases that allow us to basically get all our numbers pretty early on without having to go anywhere outside of the UT Southwestern system. Additionally, I knew early on that I wanted to go into pain medicine, so for that, it was important to me to go to a program that both not only provided pain medicine as a fellowship option, but also allowed their residents to get involved pretty early on in the chronic pain clinic. So here at UT Southwestern, we have two primary sites that we rotate at for our chronic pain rotation. One is here at Parkland Hospital, and the other one's at the VA in South Dallas. Both locations provide great experience. We see a variety of chronic pain patients. We do a variety of interventions, and there's enough volume for both you as a resident and the fellow, so there's no competing aspects there. Additionally, both clinics have fantastic faculty there. They really want to teach you, they want to support you, especially if you are interested in going into a chronic pain fellowship, which is very important to me. They're very supportive. They provide you all the options and opportunities that you would want for someone that's interested in chronic pain.
Hi, my name is Tim Shutter. I'm a CA2 here at UT Southwestern. Currently, I'm on the Parkland Chiefing Month, and I'll give you a little bit of information about that. So you basically are in a supervisor role. You get to kind of coordinate the ORs at night, including working with the CRNAs and working directly with the CA1. It's a great experience for you to kind of transition to private practice or anywhere because you're going to be in a supervisor role. It's also a great opportunity for a CA1 just because you get to do a little bit bigger cases because you really don't know what's going to come in at night, whether it be a big trauma or a cranie, so you can be doing neuro, ortho, any sort of operation at night. Also, it's a great opportunity for you as a CA2 to teach your CA1 as a mentor. They get to learn from you, from your experiences over the past year. They can kind of pick and choose some of the things that you do in the operating room that they maybe aren't able to see with an attending. So it's a good opportunity for them as well. So I plan on doing a critical care fellowship. There's also great opportunities here at UT Southwestern for critical care experience, whether it be as an intern where you can rotate at different hospitals around the Dallas area and learn directly from pulmonary and critical care doctors, or as a CA1 or CA2 or CA3, whether it be in the SICU at Clements, whether it be in the CVICU, which is an excellent experience at Clements as well, whether it be at the VA ICU, where you get a little bit more responsibility at night, which is also an excellent experience.
Hallo, ich bin Juli, ich bin von Deutschland und ich liebe es, hier in der UT Southwestern Familie zu sein. Hi, I'm Julie. I'm one of the CA2s. I am from Germany and I'm part of the UT Southwestern family. I love being here because UT Southwestern offers a great variety of unique strengths. One of them is this really strong academic base, but also is based in Dallas in a really wonderful work environment. Right now, I'm doing my acute pain rotation. It is a dedicated month exclusively for blocks. It includes truncal blocks, neuroaxial blocks, and extremity blocks. We rotate at 2 different sites, and every day you get to experience different variety of blocks, and you get to improve your skills, and you learn how to manage an ultrasound machine, and with the help of your attendings, you develop a great skill set. One thing that makes me excited about acute pain is that you can help patients relieve their pain. Some people come out of surgery with a lot of pain, and you see an immediate effect of that medication, that procedure that you do make a difference in the patient's care. I love our neuro rotation because it is a really close-knit family. The attendings, the surgeons, everyone knows each other and work together as a team. We have a large variety of cases that we get exposed to, open craniotomies, variety of spine cases, and also endovascular cranial procedures. Our neuroanesthesia faculty are a very close-knit group, always happy to help and very diverse.
Hi, my name is Emily Turner, and I'm a CA3 here at UT Southwestern. One of my favorite rotations here has been rotating through the outpatient surgery centers. The main reason that I like them so much is that we get to do a lot of cases and they're all really quick. And so turnovers are faster, the cases are a little bit shorter. You kind of have to be 3 steps ahead at all times. And so that will hopefully prepare me to go out into private practice next year.
My name is Tamario Davis, CA3 from Annapolis, Maryland, came from Howard University, now finishing my residency here at UT Southwestern. One of the big reasons I came to UT Southwestern for residency is due to its location in a major metropolitan area where we can do a huge variety of cases, huge volume of cases, and a huge complexity of cases since we're the only anesthesia residency in the Dallas area. So my future plans after this year is to go to the University of Maryland for a cardiac fellowship. I feel that UT Southwestern has uniquely prepared me for this cardiac fellowship in that during residency, while we're with fellows, we're not reliant on fellows. So we get an opportunity to do a lot of the big cases, the complex cases that at other institutions only the fellows have the opportunity to do. So during the CA3 years, we have a few unique opportunities to further our education as well as prepare us for the future. One big rotation is our pre-attending rotation. This is where we act as our attending, essentially managing sometimes multiple rooms or working with CA1s for those preparing for a future in academics. It allows us the unique opportunity to take a step back and have a full picture of the OR, which eventually will help us the most in our future career. Another unique opportunity we have in CA3 years is the opportunity to do liver transplant. So liver transplant is a rotation that, in a way, brings everything you've learned from the first 2 years and puts it all together. It's a big case where you have a lot of components from prior rotations that all come together and coalesce. We have amazing surgeons that have ramped up our liver service, so now we have the opportunity to not just do a couple, but in the order of almost tens of livers before graduating residency.